Are on the front lines of the coronavirus pandemic. However, the disease is taking an enormous toll on those that are caring for patients in affected areas. In an op-ed for The Hill, Dallas Dukar, a nurse practitioner at Massachusetts General Hospital, puts it this way. Nurses don't have the supplies they need to stay in this fight. Failing to give them what they need threatens their health and that of the entire country. With me now is Cheryl Peterson, Vice President for Nursing Programs for the American Nurses Association. Thanks so much for joining us. I am curious, when you are speaking with nurses, what are their biggest concerns?
Right, you've already hit on it, right? How are we going to keep our nurses safe? Do they have the personal protective equipment that they need? And then also, are there enough of them in the institutions that are helping to provide care? So it's both a staffing question and it's a personal protective equipment question.
So, Cheryl, give me a sense of what it would look like for nurses to have what they need to fight this effectively.
Right. So you heard somebody talk earlier actually about how is this transmitted. And the question that we have to deal with for nurses and other members of the healthcare team is, where are we most vulnerable? Is this transmitted by a relatively large droplet that flies through the air and then lands on a surface, or is it a really small particle that can float along in the air for a while? And the answer to that question tells us what kind of respiratory protection do we need? And that's where our challenge lies. People have heard, do we not have enough N95 respirators? These are really important, a mask, but it's a respirator that really filters out those very small particles that can float through the air, which really is probably the level of protection that we need. However, those are in short supply. So now we're looking at how do we look at a medical or surgical face mask, and how does that provide us sufficient and appropriate protection depending upon what it is we need to do in patient care. But it's a real conundrum.
I was going to ask you how nurses should be protecting themselves, but I think what I'm hearing from you is that what we actually need is to know more about this virus.
Yeah, it's twofold. One is, do we really need to know how is it transmitted? We understand from other coronavirus strains how they are transmitted. We know it's principally by a droplet, that large droplet that doesn't hang in the air long. However, we're not really sure about the behavior of the COVID-19. And so that's really a challenge.
When you look at the legislation that was passed by the House, this aid bill, does it begin to address some of these concerns?
Well, the piece that was just passed last night was really focused on economic stimulus, which is really important, a response to this. We're hoping that in future legislation they'll really look at healthcare workers and nurses in particular. And I heard somebody mention our frontline firefighters and EMS, the same there, so that we're making sure we know what is the appropriate personal protective equipment. How are we going to have a sufficient supply both now and in the future, particularly if this is a long-term event?
Cheryl, we've heard a lot about nurses and doctors who may be in retirement or no longer practicing being asked to come and to serve if there are shortages in the future. Do you have a sense of what the tipping point would be at which point you would be asking those nurses to come back?
Yeah, that is a really difficult question because it really is going to depend upon the facility. We already are challenged with having a sufficient number of nurses in this country. And now we look at an event like this, which really stresses the system. And so we're urging all of our healthcare facilities to look at their nurses and other healthcare members to determine what's the best way to sustain the ability for care to be provided. And that may mean in the future that we have to look at either bringing people out of retirement. Do we look at students? Is there a way in which we can use them and not have them be put at risk, but become a valuable part of the team as we move through? But there is a lot that probably could be done in the short term about how you look at what services are you providing. Are you making sure that the nurses are being taken care of both when they're at home, but also at the place of work? That are their child care issues being taken care of so they can focus? There are things that can be done to keep them both physically, spiritually, and mentally sound to provide care.
All right, Cheryl, thank you so much for joining us.